This is Lynn. I'm a nurse practitioner student at Auburn University doing a 5-minute lecture video on folliculitis. Folliculitis is a superficial inflammation of a follicle, usually a hair follicle, caused by an infection, local trauma, or chemical irritation. It's usually caused by a bacterial or fungal infection. It can be superficial or deep. At first, it may look like a small red bump or a white-headed pimple around a hair follicle, and that infection can spread and turn into non-healing sores. They can occur anywhere on the body where hair is found. Most frequent symptom is itching, painless or tender pustules, vesicles up to 5 millimeters in size. Most commonly infectious in etiology, with the most common being Staphylococcus aureus. Also could be Pseudomonas, fungal, viral, such as HSV, herpes simplex virus, or parasitic. There's also non-infectious types, such as toxus erythema of the newborn, acne vulgaris. The skin disorders may produce a follicular eruption that includes the following of pseudofolliculitis, which occurs after shaving on the face, scalp, pubis, and legs, the razor bumps, atopic dermatitis, and follicular psoriasis. Risk factors for this diagnosis of folliculitis includes hair removing, of shaving, plucking, waxing, other periodic skin conditions such as eczema and scabies, the use of occlusive dressings or tight-fitting clothing, personal carrier of MRSA or being around someone that has MRSA, if the patient has diabetes, if the patient is immunocompromised, such as on certain medications, chemotherapy, if they have HIV, or if the patient has been in any hot tubs, saunas, any public water. The use of EGFR or epidermal growth factor receptor inhibitors, and chronic antibiotic use, which can lead to the gram-negative folliculitis. 3 key questions that are essential to ask in this workup for the diagnosis. 1, where has the patient been? Has the patient had any recent use of any public swimming areas, hot tubs, swimming pools, saunas? The pseudomonal folliculitis is that gram-negative folliculitis known as hot tub folliculitis or wetsuit folliculitis, and that's usually in areas that are occluded by the swimwear. It can also come with different problems such as fever, headache, sore throat, malaise, GI distress. Is the patient on topical corticosteroids? Do they use certain hairstyling or shaving practices? Are they on long-term antibiotics, which are all risk factors for folliculitis? And then ask about the patient's history, and that includes the medication use. Does the patient know their HIV status, especially if this is a recurrent problem? Do they have a history of STDs, especially syphilis or HIV or HSV? And then inquire about the timeline which the lesion has occurred, including any previous or similar episodes. See if they've had MRSA before or around anyone with MRSA. Usually patients with superficial folliculitis report an acute onset, and then there's usually a longer standing lesion with deep folliculitis. In the physical examination, you want to examine the lesion. What area is it in? Is it an area that the patient's been shaving? You want to measure the lesions. They're usually 1 to 5 millimeters wide. And examine the site for any redness, drainage, fluctuation. Sometimes it can be a widespread rash, especially in the pseudomonal folliculitis. For diagnosis, it's usually made clinically, taking risk factors, history, and location into account. They get a culture and gram stain of the pustule, KOH preparation to identify any yeast, and then a smear if you're suspicious of herpetic folliculitis. Most common treatment is antiseptic and supportive care. Systemic antibiotics may be used, but usually are not. Usually just general measures for treatment is to avoid shaving and waxing, warm compresses 3 times a day. Topical Bactroban can be used, especially in Staphylococcus aureus, and then topical antifungals for fungal folliculitis. Priority teaching components. It's extremely important to educate patients on proper hygiene and skincare in order to prevent chronic or recurrent cases. Priority teaching includes antibacterial soaps. You can use bleach baths 1 to 2 times a week. Keep the skin intact. Daily skincare. Avoid scratching, and make sure to use clean shaving instruments daily, or to use a disposable razor and dispose after that first use, and especially change washcloths, towels, and sheets daily. And for obese patients, weight reduction will decrease skin-on-skin friction. Thanks, guys. Hope you learned something.